Welcome to Shah Medical Surgical. Today we will talk about capsule Tamsulosin. Before you take your next Tamsulosin capsule, stop for just 1 minute. What if I told you that the way you take this medicine could make a huge difference? Many men swallow Tamsulosin every day, expecting it to solve their urinary problems. But some unknowingly make simple mistakes that can lead to dizziness, poor results, or unnecessary side effects. And here's something even more surprising: some men assume that because their symptoms improve, they no longer need medical follow-up. Unfortunately, that assumption can sometimes delay the diagnosis of a more serious prostate condition. So, before you take your next dose, stay with me. In today's video, I'll share 12 important facts every Tamsulosin user should know, including the best way to take it, foods and drinks to be careful with, medicines that may interact with it, possible side effects, and one warning that every man should never ignore. Let's get started. What exactly is Tamsulosin? And why has your doctor prescribed it? Imagine trying to squeeze water through a tightly pinched garden hose. The water slows down, the pressure builds up, and only a weak stream comes out. That's very similar to what happens in many men with an enlarged prostate. As men grow older, the prostate gland can slowly increase in size. When that happens, it may press against the urethra, the tube that carries urine out of the body. The result? A weak urine stream, difficulty starting urination, frequent trips to the bathroom, waking up several times every night, or feeling like your bladder never empties completely. This is where Tamsulosin comes in. Instead of shrinking the prostate, Tamsulosin relaxes the muscles around the prostate and the bladder neck. When those muscles relax, urine can flow more freely, making urination easier for many men. But here's something many people don't realize: Tamsulosin helps control symptoms, it doesn't cure the enlarged prostate. That's an important difference we'll come back to later. When should you take it? Morning or night? One of the most common questions patients ask is, "Doctor, should I take Tamsulosin in the morning or before going to bed?" The good news is, both can work. What matters most is taking it consistently. Many doctors recommend taking it about 30 minutes after the same meal each day, because taking it after food can help your body absorb the medicine more predictably. Some people prefer taking it after breakfast. Others take it after dinner. But what if Tamsulosin makes you feel dizzy? If you notice dizziness after taking the medicine, your doctor may recommend taking it in the evening instead. That way, you may sleep through some of the side effects. Don't expect a miracle after the first capsule. Here's a mistake many patients make. They take 1 capsule, maybe 2, and then think, it's not working. So they stop taking it. But that's not how Tamsulosin works. Although some people notice improvement fairly quickly, for many men it takes several days, and sometimes longer, to experience the full benefit. Think of it like opening a rusty door. The first push helps. The next push makes it easier. Eventually, the door begins to open much more smoothly. The same idea applies here. If your doctor has prescribed Tamsulosin, take it exactly as directed and give it enough time to work. And remember, if you stop taking it without medical advice, your urinary symptoms may gradually return because the medicine is no longer relaxing those muscles. The side effect that surprises most people. Now let's talk about something that catches many men completely off guard. Imagine getting out of bed in the morning, you stand up, and suddenly, everything feels like it's spinning for a few seconds. That lightheaded feeling is one of the most common side effects of Tamsulosin. Why does it happen? Although Tamsulosin mainly works on the prostate and bladder, it can also slightly lower blood pressure in some people, especially when treatment first begins. That's why you should never jump out of bed too quickly after starting this medicine. Instead, sit up first. Wait a few seconds. Then stand up slowly. This simple habit can help reduce the risk of dizziness or even fainting. The good news is that many people find this side effect becomes less noticeable as their body adjusts to the medication. However, if you continue to experience severe dizziness, fainting, or falls, don't ignore it. Contact your healthcare provider promptly because your treatment may need to be reviewed. The drinks that could make your symptoms worse. Now here's something many people never think about. Imagine taking your medicine every single day, but one simple habit is quietly making your urinary symptoms worse. What could it be? The answer might already be sitting in your refrigerator. Many drinks can irritate the bladder, even if they don't directly stop Tamsulosin from working. For example, large amounts of coffee, strong tea, energy drinks, and carbonated soft drinks. These beverages may increase bladder irritation in some people, making you feel like you need to urinate more often or more urgently. That doesn't necessarily mean you must completely avoid them. But if you notice your symptoms become worse after drinking them, try reducing the amount and see whether it makes a difference. Sometimes, small lifestyle changes work together with your medicine to give you better results. A common problem that can make urination more difficult. Let me ask you something. Have you ever thought that constipation could affect your bladder? Most people haven't. But it actually can. When the bowel becomes full of hard stool, it can put extra pressure on the bladder and the surrounding tissues. For someone who already has an enlarged prostate, that extra pressure may make it even harder to empty the bladder comfortably. The good news? This is often something you can improve. Try to include more fiber-rich foods in your daily meals. Fresh fruits, vegetables, whole grains, beans, and drink enough water during the day, unless your doctor has advised otherwise because of another medical condition. Regular physical activity can also help keep your bowels moving normally. Healthy habits don't replace your medicine, but they can certainly support it. One simple nighttime habit that may help you sleep better. Do you wake up 2, 3, or even 5 times every night just to urinate? If yes, you're definitely not alone. Many men with an enlarged prostate struggle with interrupted sleep. Although Tamsulosin may improve urine flow, your evening routine also matters. If you drink large amounts of water, tea, or other beverages just before bedtime, your bladder will naturally fill during the night. That means more trips to the bathroom. Instead, try spreading your fluid intake throughout the day. If appropriate for your health, reducing large drinks shortly before bedtime may help reduce nighttime urination. However, never reduce your daily water intake too much. Staying properly hydrated is still important for your overall health. If nighttime urination continues despite treatment, speak with your healthcare provider because there may be other causes that need evaluation. Medicines that don't always mix well with Tamsulosin. Here's something that surprises many patients. Sometimes, the problem isn't Tamsulosin itself. It's the combination of medicines. Tamsulosin can interact with certain prescription medications, over-the-counter medicines, and even some herbal supplements. For example, medicines used to treat high blood pressure may increase the risk of dizziness when combined with Tamsulosin. Medicines for erectile dysfunction, such as sildenafil or tadalafil, can also lower blood pressure. That doesn't always mean they cannot be used together. But they should only be combined under the guidance of your healthcare professional. Some antifungal medicines and certain antibiotics may also change the way your body processes Tamsulosin. That's why it's extremely important to tell your doctor and pharmacist about every medicine, vitamin, or herbal product you are taking. Even a medicine that seems unrelated could potentially affect your treatment. Remember, never start or stop a medication without medical advice. A simple conversation with your healthcare provider can prevent unnecessary side effects and help your treatment work more effectively. Now let's talk about a question many men want to ask, but often feel embarrassed to mention. Can Tamsulosin affect sexual function? The answer is yes, it can, but probably not in the way most people expect. Many men worry that taking Tamsulosin will cause erectile dysfunction. In reality, Tamsulosin is not designed to reduce sexual desire or directly cause erectile dysfunction. However, some men notice changes in ejaculation. For example, the amount of semen released during orgasm may become much smaller, or sometimes semen may flow backward into the bladder instead of coming out normally. This is called retrograde ejaculation. Although it can be surprising, it is usually not dangerous. Once the medication is stopped, this effect often improves. However, if these changes become bothersome or affect your quality of life, don't stop the medicine on your own. Speak with your doctor. Sometimes another treatment option may be more suitable. One rare side effect you should never ignore. Now here's the warning every man should know. Although it's extremely uncommon, there is one medical emergency linked with medicines in this group. It's called priapism. This means an erection that lasts for several hours and becomes painful. If this ever happens, do not wait. Do not feel embarrassed. Go to the nearest emergency department immediately. Delaying treatment can permanently damage the tissues of the penis and may lead to long-term erectile problems. Thankfully, this complication is very rare, but knowing about it could make a huge difference. Sometimes, simply being aware of a rare emergency is just as important as knowing the common side effects. When should you call your doctor? Many side effects improve as your body gets used to Tamsulosin. But there are situations where you shouldn't wait. Contact your healthcare provider if you notice persistent dizziness, repeated fainting, severe allergic reactions such as swelling of the lips, tongue, or face. Difficulty breathing. Blood in the urine that is new or getting worse, or urinary symptoms that suddenly become much more severe. And if you're completely unable to pass urine, seek urgent medical attention. A blocked bladder can become a medical emergency and may require immediate treatment. Remember, never ignore warning signs simply because you're already taking medication. The biggest mistake many men make. Finally, let's talk about the mistake that can undo all the progress you've made. Many men begin feeling better after taking Tamsulosin for a few weeks. The urine flows more easily, they sleep better, they don't rush to the bathroom as often. And then they think, I'm cured. I don't need this medicine anymore. So they stop taking it without asking their doctor. Unfortunately, the medicine hasn't cured the enlarged prostate. It has simply been helping the muscles around the prostate stay relaxed. Once the medicine is stopped, those muscles may tighten again, and the urinary symptoms can gradually return. That's why regular follow-up with your healthcare provider is important. Your doctor may decide to continue the medication, adjust the dose, recommend another treatment, or investigate whether another condition is causing your symptoms. Never make changes to your treatment plan without medical advice. So before you take your next Tamsulosin capsule, let's quickly remember the most important points. Take it exactly as prescribed. Try to take it at the same time each day after the same meal. Don't expect immediate results, give it time to work. Stand up slowly if you feel dizzy. Be mindful of drinks that may irritate your bladder. Prevent constipation with healthy eating and regular activity. Discuss all your medications with your healthcare provider to avoid unwanted interactions. Don't ignore changes in sexual function, talk openly with your doctor. Know the rare emergency warning signs and seek help immediately if they occur. And most importantly, never stop Tamsulosin without speaking to your doctor first. If you found today's video helpful, please take a second to like this video. Share it with your family and friends, especially anyone who has been prescribed Tamsulosin or is living with an enlarged prostate. And if you are new to Shah Medical Surgical, don't forget to subscribe and turn on the notification bell. Every week, we bring you easy-to-understand, evidence-based medical information to help you make informed decisions about your health. Thank you so much for watching. I'm glad you spent these few minutes with me. Stay healthy, stay informed, and I'll see you in the next video.